You've probably been told that feeling tired, breathless, or a little unsteady after 65 is just part of getting older. Here's what the research actually says. Eyesight index, SCRC 81-1. While some discomforts are indeed normal, overlooking certain warning signs can delay diagnosis, worsen underlying conditions, and in some cases become life-threatening/sight. Precisely because they get waved away as ordinary aging. Tonight, 7 signs your body may be sending that deserve a real conversation with your doctor, not a shrug. Quick note first, this channel is for general education, not medical advice, and I'm not your doctor. This isn't a diagnostic checklist, it's a guide to knowing which everyday complaints are worth escalating, and which genuinely can wait for your next routine visit. I go through what research and clinical guidance actually say, not vague reassurance, not fear, so you can tell the difference between normal aging and something worth flagging. Today, 7 signs, what each one can mean, and exactly when it crosses from mention it eventually to call today. Stick with me for number 1. It's the sign doctors say gets dismissed more than any other on this entire list, often for months or years at a time. Before we start, tell me your age and where you're watching from in the comments below. Here's what almost no one explains. After 65, your body's warning systems don't always work the way they did at 40. The sight index SCRC 81, the aging immune system doesn't respond to infection as effectively as it once did, so infections can progress rapidly while producing fewer obvious symptoms/sight, meaning a senior with a real infection might not run a high fever the way a younger person would. This is exactly why waiting to see if it gets better is a riskier strategy after 65 than it was at 35. Your body's alarm system is quieter, not because the danger is smaller, but because the alarm itself has aged too. Tiredness that sleep doesn't seem to fix. Mechanism, sight index/81, and persistent fatigue can be linked to heart disease, thyroid disorders, sleep apnea, anemia, or even depression/sight. A wide list, which is exactly why it shouldn't be dismissed as simply getting older. Analogy: fatigue like this is less a single warning light and more your whole dashboard dimming at once. It doesn't point to one specific problem, but it tells you something in the system needs a look. Evidence drop. Sight index STEX 76-1. About 16% of older adults have heart disease/sight, a condition that sight index STEX 76-1 can cause the heart to pump faster to meet the body's needs, leading to fatigue, lightheadedness, nausea, or reduced appetite. L/sight. Prescription. Fatigue lasting more than 2 to 3 weeks, especially without a clear cause like poor sleep or a recent illness, deserves blood work and a real conversation, not an assumption. Bridge. Fatigue often travels quietly. The next sign is much harder to ignore because you can feel it in your chest. Shortness of breath, even with mild activity, getting winded, doing things that never used to wind you. Mechanism. Eyesight index SCRC 81-1. While aging can reduce lung capacity somewhat, persistent or sudden shortness of breath often points to an underlying condition, sight, rather than simple deconditioning. Analogy. Think of your lungs and heart as a delivery team working together. If oxygen delivery to your body starts falling behind, breathlessness is the team's way of signaling it can't keep pace anymore. Evidence drop. Sight index NU 791. That sudden shortness of breath, with or without chest pain, can indicate serious conditions such as heart failure, pneumonia, or a heart attack. Evil/sight. Nuisance versus emergency line. Mild breathlessness after real exertion, like climbing several flights of stairs, is common. Sight index STEP 79-1. Sudden shortness of breath needs immediate medical attention/sighty. Don't wait it out. Prescription. If breathlessness is new, worsening, or happening with less activity than before, That's a same-week doctor visit at minimum, sooner if it's sudden or severe. Bridge. Breathing problems and heart problems often overlap with something happening in your chest directly. Chest discomfort, pressure, or pain name plus frame, not always the classic elephant on the chest. Sometimes it's subtler than that. Mechanism. Eyesight index, seconds 8111 found mind chest pain, could be indigestion or muscle strain, but it can also signal heart disease or a heart attack. 1/sight. Analogy. Your heart doesn't have a separate minor issue alarm. Chest discomfort is the one signal it has, whether the cause turns out to be small or serious, which is exactly why it can't be sorted out from home. Evidence drop. This is consistently ranked among the most urgent symptoms in senior health guidance, precisely because the cost of waiting on a true cardiac event is measured in minutes, not days. Nuisance versus emergency line. Sight index SCRT 8119 immediate medical care is essential for chest pain. Calling emergency services rather than waiting is always the safer choice. Sight prescription. Any new or unexplained chest discomfort, especially with sweating, arm pain, jaw pain, or breathlessness, means calling emergency services, not scheduling a future appointment. Bridge. Now to a sign that shows up not in your chest, but in your legs and your balance. Feeling unsteady, or an actual fall, even one that wasn't a big deal. Mechanism. Sight index 781-1 in 4 older adults, falls every year, but not all of them tell their doctor/sight. And sight index 78-1 if you fall once, your chance of falling again doubles/sight. Analogy. A fall is rarely just a fall, it's often the visible tip of an underlying issue, whether that's blood pressure, medication side effects, vision changes, or muscle weakness. The way a single cracked tile can be the first visible sign of a shifting foundation. Evidence drop. Sight index CLETST 81 dizziness and weakness often begin well before an actual fall occurs/sight, which means the earlier warning sign, feeling unsteady, is worth reporting even before a fall happens. Prescription. Sight index 78-1 tell your doctor when a fall happens. Even if you feel fine afterward/sightee, since injuries aren't always obvious immediately. And the fall itself may point to a fixable underlying cause. Bridge. Falls and dizziness sometimes trace back to something happening much more quietly, inside your mind, not your body. Not the occasional misplaced keys, a pattern that's actually interfering with everyday tasks. Mechanism. Eyesight index SEC 81, 1 mild forgetfulness is common with age, but sudden or severe memory loss, confusion, or difficulty completing daily tasks may signal dementia, stroke, or another medical issue. Psalm/sight. Analogy. Ordinary forgetfulness is like occasionally losing your place in a book. Concerning memory change is more like consistently forgetting what the book is about altogether. Evidence drop. Eyesight index SLUC 78-1/dementia can occur in up to 11% of the over 65 population/sighty, and early diagnosis meaningfully changes how the condition can be managed. Prescription. Eyesight index SLUC 81-1 it's important to consult a doctor if memory issues interfere with daily life/sighty, cooking, paying bills, following conversations, rather than waiting for a dramatic moment to bring it up. Bridge. Mental health changes deserve just as much attention as memory changes, and they're often even more overlooked. Persistent low mood, withdrawal, or loss of interest, not sadness that passes, a heaviness that's stuck around for weeks. Mechanism. A sight index 76-1 TANS depression affects about 15% of older adults and is a treatable medical condition, not a normal part of aging/sight. A point worth repeating, since it's so often assumed to simply come with the territory. Analogy. Eyesight index lesson 77-1 doc social withdrawal can be a genuine warning sign, not just a lifestyle change/sighty, like a plant that stopped reaching toward the light. The pulling back itself is information, not just a personality shift. Evidence drop. Site index pull 771. Social isolation is strongly linked to depression, anxiety, and faster cognitive decline/site, making this sign connected to several others on this list, not standing alone. Prescription. Site index pull 761. If you've experienced warning signs of depression, talk to your doctor about treatment options/site. And eyesight index /771. Chief thoughts ever turn to life not being worth living, that deserves immediate attention. In the US, you can call or text 988 anytime to reach a trained counselor. Free and confidential. .o/site. Bridge. And now, the sign I teased at the very start. The one doctors say gets dismissed longer than any other. Unexplained weight loss, losing weight without trying. The sign that sounds like good news and almost never is. Mechanism. Eyesight index 27911. If an older adult loses weight rapidly without changes in diet or activity, it could signal diseases such as cancer, diabetes, digestive issues, or thyroid disorders. DIL/site. Analogy. Your body normally maintains its weight the way a thermostat holds a steady temperature. Unexplained weight loss means something has quietly reset that thermostat, and it's worth knowing what. Evidence drop. This symptom appears across nearly every major disease category affecting seniors, which is exactly why it's treated as a priority red flag rather than something to be pleased about. Prescription. Site index .791. A timely medical checkup can make a real difference/site. Bring a simple record of your weight over recent months if you have one, since the pattern matters as much as the number itself. Bridge. None of these 7 signs alone means something is seriously wrong, but dismissing all of them as just aging is exactly the pattern doctors say costs people the most time. Illustrative case. Consider someone like Margaret, a composite, not a real patient, 71 years old, who'd noticed she was more tired than usual, had lost a bit of weight without trying, and had started skipping her weekly card game with friends. Individually, each seemed minor, just a rough patch. Together, brought to her doctor at once, they painted a clearer picture that led to blood work catching a thyroid issue early, well before it became a bigger problem. That's the real value of knowing this list, not diagnosing yourself, but recognizing when a pattern deserves a real conversation. Emphasis plus safety plus tonight's plan. Here's why this matters. After 65, your body's warning systems get quieter, not less important, which means the responsibility shifts more onto you and your loved ones to notice and speak up. None of these 7 signs are a diagnosis on their own, but 2 or more together, or any one of them lasting more than a couple of weeks, is worth a direct conversation with your doctor, not a wait-and-see approach. And remember the emergency line. Sudden chest pain or sudden severe shortness of breath means calling emergency services immediately, not scheduling a future visit.